You can reach IPM Calicut by taking an auto, cab, or bus from railway station or from the airport. It is located in the medical college campus, Kozhikode or Calicut. So you have to ask for to drop you near the chest hospital or the chest department of GMC Calicut. It is just 400 meters far from the chest hospital. You can use the Google map. So I have reached here during the time where a lot of renovation and construction work is going on. So it will be, I think, very different in few years. I have come here to learn and explore about palliative care because IPM is the pioneer in palliative care movement in Southeast Asia, and it was WHO's first collaborating center for community participation in palliative care. So they have developed Kerala model, which is very famous, and Dr. Suresh is one of the founding member of this institute. So it was started as Pain and Palliative Care Society in 1993, and 8 years later IPM was formed, and IPM is training and research and outreach arm of PPCS. A lot of infrastructure is developed through the grant or through the philanthropic work or some donations by the people. Inside the hospital, it is very comfortable and homely environment for everyone. There is no security guard, no white dress code to scare away the patients, and it is very quiet and calm environment. And patients love this place and they don't want to go back. In inpatient department, they have a 30-bedded facility, and all the rooms are very well lit with the natural lighting, and cross ventilation is there for all the patient. They have a separate bed for the caregiver also. IPD facility is completely free for patient. For all the new patients, they do a family meet where they provide psychosocial support, they assess the need, and they also plan the goal of care, and it is a very intense or very emotional meet. Every day there is a bedside clinical round with Dr. Lulu Matthew, who is academic director here, and there are a lot of students who come for certification, workshop, training, volunteers. Moving toward outpatient department, they have around 3 to 4 palliative care physicians who run the OPD along with volunteers, staff nurse, training students, fellowship students, and all the patients are seen first by volunteers and staff nurse and then by the doctors, and their record keeping is amazing, and their all the staff is very dedicated for patient care, and it is amazing to see their coordination to provide comprehensive care for each patient. The quality of care is very, very high. All the medications are provided at free of cost for all the patients. They are also actively involved in research and innovation. There is a journal library inside the hospital where patient or caregiver can use it or can issue a book. They have a canteen or a mess which provides free vegetarian meal for patient and caregivers, and others have to pay 30 rupees, and after the food people have to wash their own plates and give it back. Next, the very important part is home care, which is done by a team of driver and a nurse every day. They visit all the registered patients. They provide the services within the nearby 5-kilometer area, and the services are like procedures, for example, catheter change, ascitic tapping, bed sore dressing, medicine refills also they do. And a doctor's home care happen once a week. A physiotherapist also visits the patient once a week. Volunteers, training students, fellowship doctors also visit the patient. I loved that every house had a well.
How was your day, Fatima? How was your day?
Through Lions Club, they provide food kits to the poor patient or families. The most impressive work which IPM has done is that they have empowered communities to create their own palliative care societies. I was very fortunate that Mr. Suhas, who showed me his society and shared the details, they created this society with the help of volunteers and under the guidance of IPM. And initially, they raised corpus fund to get a vehicle, to get equipments, and then they hired doctors and nurses to provide palliative care in their area. And this is going very amazing, like communities being empowered. Mr. Suhas was very kind, like he took me one of the very famous restaurant, Chandra Itte, and then we had a very delicious meal. On 15 January every year, they celebrate Kerala Palliative Care Day, in which all the caregivers were called to share their experience. They organize a lot of meetings for caregiver and patients to bond and, for support. I attended a death cafe which was organized. It was quite memorable one for me. Inside the campus, they have a rehabilitation center where they also provide vocation training for the patients. I got opportunity to meet Dr. Suresh and discuss few points and to learn from him. We also had a session with Stella ma'am regarding the nursing care, which was amazing. The campus of IPM is full lush green kind of a forest, but it is accessible to even patient with disability. Lot of payment is there, and it's very relaxing and very beautiful ambience. So they have two guest house in the block 1, which has 6 rooms which are AC and twin sharing, and in block 2 there are 12 non-AC rooms, each can accommodate 3 guests. Right now I am in January, it's 7th January, and the temperature is quite cool here. Like these look so much green. It is. So what I found is their team is very nice. Everyone is so dedicated. Everyone knows what work they want to do. There is no confusion, and they're very passionate. That's very nice. We're just keeping everyone gelled together and bringing a very good outcomes and good care for patients. That thing is impressive to learn. A lot of people come here for internship, observership, for certification, fellowship, training, and it was amazing to meet all of them. I made so many new friends, and we explored Calicut food and very delicious items and explored the whole city. one of my colleague invited me for lunch and for the annual temple festival of Ma Bhagwati, which was mesmerizing.